We are seeing centers across the country with expertise that can perform these procedures. This is not a procedure which is just should be performed by one person. This should be performed at a highly skilled, tertiary multidisciplinary center which specializes in this form of treatment. Here at Drexel, we have a team which includes myself, nurses, anesthesiologists, intensivists, radiologists, pathologists, which are dedicated towards the treatment of this disease. There is no difference in terms of outcomes with cytoreductive surgery and HIPEC and other major surgeries for other major abdominal malignancies. The patients do similarly as well. The important part is developing a standardized approach. Every patient has a standardized approach to treating these patients. Now, the challenge for many patients is that their healthcare providers are not aware of this new treatment approach. It's largely a result of the diseases that we treat. Appendiceal cancer, namely pseudomyxoma peritoni, is very rare and may go unrecognized by radiologists, pathologists, surgeons. We see a high volume of these patients referred to us. It's important that we educate the physicians outside of the greater metropolitan area so that they recognize these types of disease entities and refer these patients to centers of excellence that can offer a multidisciplinary approach to improve their outcomes. It's giving talks, seminars. We will be hosting our PMP Appendiceal Cancer Symposium 2016, where we will have national speakers from our institution, radiologists, pathologists, nurses, and importantly patients who will relate their experiences, trying to bring a perspective in education which will hopefully inform and educate the medical community, which understandably do not know much about this disease, our diseases. When I was going through my training, we would review these types of clinical scenarios as unsalvageable. This is now a treatment paradigm where we can offer hope and a longer-term survival with stage 4 disease. We look at stage 4 disease very differently now. In the past, it was looked at as a death sentence. Nothing could be done. Now we're seeing remarkable survivals in patients who meet the criteria for undergoing this procedure. This is one step along the way. This is now, but it is also the future. We're developing, finding new ways, understanding the science, and looking at how patient tumors translate to outcomes. We're also applying our targeted approaches, looking at molecular profiling, taking these tumors. We're looking at more targeted approaches based upon the genomic profiling of the tumors. That, together with systemic targeted approaches, cytoreductive surgery, and with heated intraperitoneal chemotherapy, together can offer patients a greater survival advantage.